Welcome to Session 2 of our Anxiety Management course. In Session 1, we looked at some of the common signs and symptoms of anxiety and how anxiety can affect our thoughts, feelings and behaviours in unhelpful ways to create a vicious circle. What we want to do throughout the Anxiety Management course is to help you to weaken this circle. In the previous session, we discussed the benefits of recording the situations in which you are anxious and writing down the thoughts, feelings and behaviours that you experience in situations using an anxiety diary. How did you get on with this? Did you notice any patterns or similarities in the situations that make you feel anxious? For example, social environments, busy places or public speaking. Did you manage to make any connections between your thoughts, feelings and behaviours? Don't worry if you're finding this concept difficult just now. The further we get into the course, the more sense this will hopefully make. In the previous session, we also suggested some ways to get started on managing anxiety and highlighted the importance of regular exercise. How did you get on with this? Did you make some changes or try some exercise? If you did, well done. If you didn't manage to make some changes or try some exercise, then why not make this your goal for next week? It's never too late to make a start. In this session, we will focus on how anxiety affects the body, the physical symptoms of anxiety. We will also look at what you can do to manage these symptoms. In Session 1, you may remember that we mentioned some of the common physical symptoms of anxiety, namely muscular tension, rapid breathing, and increased heart rate, amongst others. These are often the symptoms that those people with anxiety notice first, probably because they can be very uncomfortable and can be quite distressing. Indeed, some people who regularly experience the physical symptoms of anxiety may misinterpret their symptoms for illness or an underlying medical condition. This is one of the reasons why it can be helpful to understand better what kinds of physical symptoms are associated with anxiety and why we experience these symptoms. Let's go back to our vicious circle. Highlighted in red here, physical symptoms is the area of our focus for this session. If we have a better understanding of the physical symptoms of anxiety and can learn and use strategies to reduce these physical symptoms, then we can weaken the vicious circle and by doing so reduce the effect that anxiety has on us. Let's look in more detail at how anxiety can affect our body. To understand how anxiety affects our body, it is important to understand what we call the fight or flight response. You may remember this phrase from Session 1. Let me talk you through how this response comes about. When we sense danger or threat, we experience a strong emotion called fear, which leads us to feel anxious. Fear and anxiety trigger a chain of automatic events in our bodies that prepare us for action to either fight, defend ourselves, or flight, run away. For example, imagine you're walking through the woods and come face to face with a bear. Your heart starts beating fast, your muscles tense, you're intensely alert. For a split second, you are paralysed with fear. Then you make a decision. You decide to either defend yourself or run away. This physical reaction to anxiety is inbuilt within every human being and can be traced back to our need for survival in the past. Although it is a normal and helpful response when we are faced with immediate danger or threat, it is unhelpful when it is switched on if the threat is low or happens in a situation where there is no real threat. For example, when you're speaking in front of people or queuing up in the supermarket. The physical symptoms that we experience when our fight or flight response is triggered all happen for a reason. They are our body's way of trying to protect us. Let's consider some of the common physical symptoms of anxiety triggered by the fight or flight response. As we go through the list, you may notice that you have experienced some or all of these symptoms at some point. It may be that you have never associated them with anxiety up until now. You may have noticed that when you're anxious, your heartbeat becomes stronger and faster. This happens because the heart is pumping more blood to the muscles in our arms and legs, which are important if we need to fight or run away. More blood carries more oxygen, which allows our muscles to work harder. Tingling and numbness in our toes and fingers is as a result of limited blood supply where it is most needed. This is why our skin may look pale or feel cold. When we are anxious, our breathing quickens and becomes shallow. This helps oxygen to be carried around the legs, arms and lungs via the bloodstream. Unfortunately, side effects may be chest pain, breathlessness, a choking feeling and/or blurred vision. We may also feel dizzy as a result of rapid breathing, as less blood reaches our head. Whilst this is not dangerous in any way, it produces unpleasant symptoms such as confusion and hot flushes. Although we may feel as though we are going to faint, this is very unlikely to happen, as to faint our blood pressure has to drop. However, because our heart beats faster, our blood pressure is actually temporarily raised. Muscular tension and headache is another very common physical symptom of anxiety. Our muscles tense up in preparation for fight or flight, which results in feelings of tension, aches and pains, trembling and shaking. Other common fight or flight related symptoms include nausea and dry mouth. We experience these symptoms because the digestive system shuts down, as it is not seen as being important for our survival. This means that our stomach becomes less active, causing nausea, and we may also feel a sudden urge to go to the toilet. We may also produce less saliva, which causes a dry mouth. Sweating is another uncomfortable physical symptom of anxiety. Your body works hard to prepare you to attack or run away, which causes sweating. Sweating helps you to cool down. You may wish to take a few moments at this point to think about what changes you notice in your body when you're feeling anxious, and in what situations these changes occur. It may be helpful to write these down. Remember that although the physical sensations you experience when you're anxious can be unpleasant and scary, they are not harmful in any way. Although you may naturally want to escape from the situation that is making you feel anxious, you will find that if you're able to face the feared situation, your anxiety will come down, even if you stay in that particular situation. Take a look at this graph. It shows us that when we are in a situation that makes us feel anxious, our level of distress rises. This is when we are likely to experience some of the physical symptoms that we have just discussed. The graph shows us that if we stay in anxiety-provoking situations, our anxiety level will come down over time. If you're someone who tends to escape from situations that make you feel anxious, then it is unlikely that you will have stayed around long enough to see that your anxiety would reduce. Instead, what you have done is associated escaping from a situation with a reduction in anxiety symptoms, when in actual fact, the same reduction would occur even if you were to stay in that situation. If you continue to face the feared situation again, your anxiety will be slightly less than before and may even pass more quickly. This should happen each time you face the feared situation, as shown in the graph. The message here is that although the physical symptoms of anxiety are distressing and uncomfortable, it is worth it in the longer term to stand your ground and confront the situation that makes you feel anxious. Continuing to put yourself in situations that you find anxiety-provoking will help to reduce your physical symptoms over time. Now that we've considered the physical symptoms of anxiety and why we experience them, let's move on to part 2 of this session, what we can do to manage these physical symptoms. First, just take a few moments to consider what you currently do to manage the physical symptoms you experience. There are some effective techniques that have been specifically designed to help us to relax and to gain control over the physical symptoms of anxiety. These techniques are called controlled breathing and progressive muscle relaxation. If you would like to practice controlled breathing and progressive muscle relaxation techniques using an audio recording, then this is available to download from our website. As we have just discussed, at times when we feel anxious, we may notice a change in the way we breathe. We tend to take quicker and shallower breaths, which often leads to over-breathing, which is breathing too fast and taking in more oxygen than we need. We may find ourselves out of breath or feel that we need to gulp air. We may think that we are not getting enough air and that we are at risk of suffocating. This can cause tightness in the chest and lots of other unpleasant sensations, such as dizziness, a feeling of choking, and/or feeling faint, as mentioned earlier. Breathing is one of the easiest physical sensations to control by yourself. Remember, practice calming your breathing many times before using it to control the symptoms of anxiety. You may find it takes a number of attempts before you are able to breathe calmly when you feel anxious or panicky. It is a good idea to practice this technique when you do not feel anxious, so that you can use it easily when you do. Just as when learning any new skill, it is important that you practice this technique on a daily basis to get the maximum benefit from it. Let's now turn our attention to progressive muscle relaxation. When we have been experiencing anxiety for a long time, we are often unaware of the tension in our muscles or the knot in our stomach, which are as a result of our body's reaction to stress. When we are upset or anxious, the muscles in our bodies tense up, and this can cause uncomfortable bodily feelings like headaches, backaches, or tightness in the chest. The aches and pains of tension can be painful and can cause us more worry, making us even more anxious and tense. A strategy that can help you to ease tension in your muscles is progressive muscle relaxation. It involves tensing specific muscles in your body for around 5 seconds and then relaxing them. Progressive muscle relaxation can help you to lower the overall tension in your body. With daily practice, you will then be able to recognise and respond to the onset of tension. Remember, if you would like to practice controlled breathing and progressive muscle relaxation techniques using an audio recording, then this is available to download from our website. Imaginal relaxation is another useful way to help to unwind and switch off. This involves taking yourself to a relaxing place in your mind's eye, perhaps a place that you have visited before, such as a beautiful beach, and trying to imagine as fully as possible what it feels like to be there, what you can smell, the sounds that are around. For this exercise, it can be useful to have an audio to help you to practice. This can easily be accessed or downloaded online. Relaxation is a very useful way of coping with the physical symptoms of anxiety, as it slows down the body. If we learn to turn on the symptoms of relaxation, we can turn off the symptoms of being highly strung and tense. You can't experience both at the same time after all. With practice, you can control the physical sensations associated with anxiety, and by doing so, weaken the vicious circle. Other things we can do to try and relax include dropping our shoulders and avoid tightening and stiffening up. Avoid fidgeting, trying to keep our concentration on our surroundings, the here and now, staying calm and not rushing around, slowing down our speech and talking to ourselves in a positive way. For example, saying to yourself, "Relax, I can deal with this," or "Keep calm, it will pass." If you do these things, you should find yourself slowly calming down. You will feel better if you know that, on the outside at least, you look calm. Another way of helping to counteract the physical symptoms of anxiety is by distracting yourself from the symptoms. Although we would not recommend distraction as a long-term coping strategy, it can be useful in certain situations. Thinking about the physical symptoms of anxiety will only make them worse. So trying some distraction techniques, for example, reading or talking, mental games such as counting backwards from 1000, describing your surroundings, or just keeping yourself active can be really helpful. Lastly, something that we have already discussed in session 1, but that is extremely useful for combating stress and releasing physical tension, is regular exercise. If you haven't already, then try to incorporate some form of exercise into your day. We have now reached the end of session 2. We hope that you have found this session helpful. Over the next week, you may wish to try practicing controlled breathing and progressive muscular relaxation daily. If you wish, you can use the worksheet entitled Relaxation Monitoring Diary to record how you feel before and then after you practice these techniques. This can help you to reflect on your progress. And try to continue with 30 minutes of exercise over 3 days next week. In the next session, we will consider how anxiety can affect our thoughts.